respiratory system. Now, the main function of the respiratory system is for ventilation and perfusion. Now, it is very important to understand these two terms because most of the questions that you are going to get under the respiratory system is either going to be ventilation or perfusion problem. So, what is ventilation? Ventilation is the movement of oxygen into the person, which is the process of inspiration, and then we breathe out the carbon dioxide, which is the end product of metabolism. How do you know if ventilation is working? You know that by checking the respiratory rate. And so the adult respiratory rate, the normal range is 12 to 20. This is going to be our first vital signs that we're going to talk about. So when you walk in or when they give you the respiratory rate and it's not normal, if the respiratory rate is greater than 20, it means that the person is hyperventilating. What does it mean? It means that this person is getting rid of all the carbon dioxide, so carbon dioxide levels is going to drop. On the other hand, if the person is hypoventilating, then we say that the person is having bradypnea. In this case, the person is going to be retaining a lot of carbon dioxide. So carbon dioxide in the person is going to increase. For the sake of the anchors, I want you to understand that whenever carbon dioxide levels increases, it drives the pH down because carbon dioxide forms an acidic condition. So anytime you have a condition where you suspect that the carbon dioxide levels are going to go up, you expect the person to have an acidic environment. This is very important when we come to the respiratory acidosis and respiratory alkalosis. Now, the next function of the respiratory system is to provide oxygen. And the main reasons why we get oxygen is to break down glucose by a process called metabolism in order for tissues to get energy. This is a process that provides the body with energy. And therefore, you notice that all the chronic conditions we're going to talk about, any of these chronic conditions, especially the respiratory conditions where we have less oxygen in the system, this person is going to be having less energy, and therefore one of the clinical manifestation is going to be fatigue. Because we have less oxygen, bodies are not able to get enough energy to carry out all these metabolic activities. Almost all the chronic respiratory problems, we also have weight loss. There are so many examples that I can give, but I'll just focus on these two. Now, another function of the respiratory system is to remove carbon dioxide, which is a waste product of metabolism. Now, if this process fails, we end up producing more of the carbon dioxide into the system or into our body. And this pushes the carbon dioxide levels to go up. And when that happens, the pH goes down. An increase in carbon dioxide levels causing the pH to go down is what we refer to as respiratory acidosis. So, for example, you have a patient that OD'd on any medication and then the respiratory rate dropped all the way down to 8. In this case, we expect the carbon dioxide inside the person to go up and then the pH will definitely go down, and therefore we say that this person is at risk of respiratory acidosis. So how will the doctor know that this respiratory acidosis is going on or not? The first labs that I'm going to talk about as far as respiratory the system is concerned when somebody is in respiratory distress is the ABGs. I'm not going to focus more on the ABGs, how to collect them because most of the time it is the respiratory therapists that collect them, and so it's less likely NCLEX will ask you about the collection part of the ABGs. But when it comes to the interpretation, it is within our scope of practice to do the interpretation. And so when you have the ABGs, the main thing that you have to focus on is the carbon dioxide levels. When carbon dioxide levels is up, and in this case, I'm going to talk about the normal levels should be between 35 to 45. Anything outside this range, which is here, this is what I'm talking about here. So anything above 45, we say that the person is having respiratory acidosis, and if the carbon dioxide levels drop below 35, then we say that the person is at risk of getting respiratory alkalosis. Please, this is the pH that determines if we are in acidic condition or in alkaline condition. The normal body pH is 7.35 and to 7.45. If you notice that this is what we just picked up the carbon dioxide values. This, when I was in school, that's how I got to know the normal values for carbon dioxide levels. At this time, they will give you the values. You don't have to memorize them. But what you need to know is that when carbon dioxide levels is above 45, it means that the other term that you'll be hearing is hypercapnic. Hypercapnic means that the person carbon dioxide levels has gone up. I hope by now you are getting the understanding of the function of the respiratory system is. Now, I would like us to talk about the upper respiratory airways. I'm bringing these ones up because these are very, very important, and these are terms that you'll be seeing in the NCLEX. So, for example, when we talk about the upper airways, we're talking about the nose, the sinuses, the pharynx, the larynx, and then the epiglottis. An infection of the epiglottis release or result in what we call epiglossitis. And then when the larynx is also, or we go there, be hearing something like laryngoscopy, bronchoscopy, and I'll talk about them later. If you have an inflammation in the sinus, it is called sinusitis, especially when you have an infection. Most of the nose, the function of the nose is to make sure that we humidify the oxygen that we breathe. And therefore, when somebody is having a trachea, we have to humidify the air that we give to the person. In terms of the lower respiratory system, I'm going to be talking about the trachea. And in the NCLEX, what you'll be doing is trachea and how to suction a trach patient. These are the things that you should know. And I will be talking about the suctioning aspect later. In terms of the bronchi, with the bronchi, this is where you'll be thinking about bronchitis, which is also another major airways. When we have bronchitis, we end up producing secretions, the airways are closing, and therefore we need to, carbon dioxide levels is going to go up in the person, and we end up getting what we call respiratory acidosis. Now let's come to bronchioles. Bronchioles is also the subset of bronchi, and therefore we can get also bronchiolitis. And the last part where the exchange of gases takes place is what we call the alveoli. The alveoli is where the gases takes place. But in case of emphysema, when the air get into the alveoli, they get trapped in there. And that is what causes the barrel chest because the alveoli get hyperinflated. And so um, when we take X-ray, we see that the alveoli are hyperinflated and the person will get a barrel chest. The last one I'm going to talk about is going to be the lungs. In the lungs, we'll be talking about mostly lung biopsy, where we go in and take tissues. I'll talk about them extensively when I come to the diagnostic aspect of it. But right now, what I want you to